Alrighty, moving right along, our next group is going to present Baby's Transition from the NICU to Home, clarifying occupational therapist's role in the process, and this is phase 3 of their project.
So, to get started, hi Mom, she's watching. All right, quick introduction. Transitioning from NICU to home is often an overwhelming experience. We conducted a scoping review to identify concerns and interventions for developing these preliminary OT guidelines. And our aim was to advocate for OTs to be the primary coordinators who lead the NICU to home transition. Make sure you get my good side. So background a little bit. We did a literature review to get kind of a unique perspective into how OTs help patients transition from NICU to home. These themes pertained to challenges these caregivers face during the transition process, served as a nice framework for structuring these guidelines, highlighted any concerns that caregivers commonly addressed, and helped create the structural environment to facilitate a smooth transition process. And themes we addressed with our guidelines included developmental care, developmental milestones, education on NICU transition, caregiver burden, and parent-child involvement. So now safe sleep is pretty important. We all sleep, especially babies who sleep the most. It's essential to their growth, immunity, and learning. Establishing these sleep patterns help nurture the newborn's brain development and enhance their overall quality of life. Avoid placing the child in a side lying or lying on their stomach like a prone position. It just increases their chance of any suffocation. So you want to make sure that you put them on their back and make sure they're supine, just so they have their airway clear. And some challenges faced with safe sleep. There's not a lot of information provided to parents on these safe sleep. It causes a negative effect, obviously. If you don't know what you're doing, odds are you're going to mess it up. And this leads newborns to being admitted frequently to the NICU for SIDS, which is sudden infant death syndrome. Just a couple of ways that OTs can incorporate interventions to promote safe sleep. You can use a white noise machine to kind of muffle out the surroundings. Use dim lighting, and loose clothing helps. Make sure it's not too loose, because if it's too loose, it's just another choking hazard.
Hi guys. Okay, so now we're going to talk about the environmental and contextual factors that impact development. So first, we need to know the home environment encompasses multiple components such as parental involvement, instilling healthy habits and routines, and ensuring a stimulating environment that will encourage neuroplasticity. So problems that are encountered by families during the NICU to transition phase is that there's inadequate supports from families or friends, financial constraints, and not receiving proper education. So before I go on the next slide, we need to understand that a positive environment enhances their learning experiences, making them more responsive to their stimuli and promoting sensory and motor development. However, it is our job to basically acknowledge that adverse environmental factors can impede infant development, leading to a potential delay. So we're going to talk about the challenges that they face. So newborns from low economic neighborhoods are more prone to experiencing abnormal development. Families experiencing financial strain can lead to parents facing difficulties in providing adequate care for their newborns. Studies have shown that parents that pay out-of-pocket expenses after newborns are hospitalized, along with paying for durable medical equipment, has led to parental stress, financial worry, and developmental delay. So overall, in low economic income settings, socioeconomic barriers amplify the challenges faced by families, hindering their optimal development. Parents in these communities often grapple with heightened stress and financial strain, stemming from difficulties in securing employment with adequate benefits. Additionally, economic disadvantages such as access to health care, substandard education, and insufficient early intervention services further compound these challenges. Consequently, this stress may result in inadequate caregiving, negatively impacting the social and emotional development of the child. we're going to talk about caregiver burden. Now, caregiver burden, I'm just going to give you a brief definition of it. So it's a term used to describe individuals who provide emotional, physical, and financial support to a family member heavily dependent on their caretaker. So now, stress can come in different ways for everyone. I know for me, my body just really wants to break down. So stress-related symptoms are all correlated to individual undergoing fatigue, emotional distress, insufficient support, undertaking substantial amount of responsibilities and tasks. So overall, before I wrap this slide up, I just want us as future clinicians to understand that these circumstances call for caregivers to handle significant responsibilities with heightened attention. Consequently, parents may experience a decline in confidence in their parenting skills, often leading to a depression due to the overwhelming demands and adjustments requiring in their caregiving role. This prolonged distress can significantly impact parental bonding, and it's our job to understand and help these caregivers to provide a quality care of life. Thank you.
Good morning, everyone. Occupational therapy impact on parental education, reliance on medical professional impact parents' sense of control, bonding with their newborn, and participation in the NICU to home transition. Occupational therapy can increase confidence in one's own abilities and parental infant bonding by understanding body language, cries, and sleep patterns. Occupational therapy impact on parental education, OT, facilitating family-focused coordination can help parents achieve a sense of autonomy, become better equipped with decision-making skills, improve the overall quality of life for both their child and themselves. Providing family-centered education has been known to increase parental confidence, enhance involvement in child's care, decrease symptoms of depression and anxiety. Occupational therapy impact on newborn developmental milestones. Occupational therapists are equipped to assist families with identifying developmental delays and implementing early intervention services. Once the transition process from NICU to home begins, OT ensure that the families receive adequate support and information to ensure that infants receive optimal care. Also, parents feel more confident when occupational therapists were able to provide education on feeding, mobility devices, and infant developmental milestones associated with expectation of when the infant will be rolling, crawling, and walking. Researchers have concluded that occupational therapists incorporating sensory integration during treatment is useful for enhancing brain development, decreasing stressful environment, and increased parental bonding. Our research question was, how can occupational therapy be leaders in guiding the NICU to home transition process as compared to other NICU staff? Developing preliminary guidelines where OTs are the primary healthcare providers supporting families during this transition process. In the methodology, scoping review was used in the research study to develop preliminary guidelines for OTs to use the transition process. Themes were searched in several electronic databases, collect relevant information. 126 papers were reviewed, only 59 papers were met the criteria of inclusion. Criteria of inclusion, current guidelines reflecting the latest developments in occupational therapy. Also, guidelines only included those relevant to the transition from NICU setting to home, specifically occupational therapist. Exclusion criteria was a publication that did not pertain to occupational therapy and neonatal therapists involved in NICU, discharge planning, publication written before 2000.
Okay. Oh yeah, thank you. Okay. So today I would like to talk about some crucial recommendations and outcomes related to providing the best environmental care for infants. Starting with thermal care, it is essential to keep infants warm without overheating them. To do this, ensure the room temperature is comfortable by keeping windows and door closed. Skin-to-skin contact isn't just for bonding. It helps regulate the baby's body temperature. Dressing the infants in loose layer and using a hat can also maintain appropriate body heat. It is critical to monitor the temperature, keeping it between 36.5 to 37.5 degrees Celsius. The risks associated with incorrect temperature are significant. If an infant is too cold, they may become lethargic or have respiratory problems. Overheating, on the other hand, is a risk for SIDS and can cause skin irritation. Moving on to noise control, we need to minimize stress and promote a calming environment for infants. In Allen's research in 2013, it highlights the benefit of music therapy to soothe and improve sleep as well. Lastly, let's talk about the lighting. So excessive lighting can be detrimental, so it's advisable to use low ambient lighting to support the infant's sleep cycle and overall development. So now we're exploring the effective intervention to foster motor development in infants. Our first recommendation is the use of a care toy. The care toy is designed to aid infants in improving their motor development as they reach various milestones. It provides sensory stimulation and encourages motor activity like rolling, grasping, crucial for maintaining postural stability. Moving on, we have the Qigong massage. This intervention is the most beneficial from 0 to 3 months when infants are starting to explore movement. Through the Qigong massage, we see infants learning to coordinate their limbs, promoting the opening of their hands and their ability to bring their hands to their mouth. This massage technique also helps in blood flow regulation, which is essential for developing gross motor skills. Lastly, we address the significance of tummy time, and this practice involves placing the infant on their stomach for 30 minutes spread over a 24-hour period, known to enhance their healthy growth and improve gross motor development. It provides the ability for infants to roll from front to back, lift their head, push with their arms, and move their arms and legs. These activities are foundational for subsequent development stage. So here we are addressing 2 key interventions for feeding and managing infant cries at night. First, let's talk about the non-nutritive sucking, or NNS, which includes the use of pacifiers and thumb sucking. Research has shown that when NNS is applied before oral feeding and combined with the hearing of the mother's voice, it can significantly boost the effectiveness of feeding sessions. Moving on to the nighttime interventions, we focus on parent training and behavioral techniques. These are strategies grounded in psychological learning theory and include methods like operant conditioning. To manage infant cries at night, there are 2 main approaches. The first one is extinction method, which involves ignoring the cries. The other one is graduated extension, where parents delay their response to cries incrementally, starting from 2 minutes and working up to 6 minutes. So now let's discuss the interventions for sleep development in infants. Starting with infant massage, study shows that it can lead to longer sleep periods for colicky babies, strengthen the bond between parents and child. This is a simple technique that parents can easily learn and apply at home. Skin-to-skin contact, also known as the kangaroo care, is another effective method. It's been found to improve infant sleep, feeding, tolerance, and even maternal mental health, with minimal sessions yielding big benefits. Just 30 minutes of skin-to-skin contact 3 times a week can significantly improve a baby's attachment to their parents and reduce depression in mothers. Positional devices like baby swings, wraps, slings, and crib wedges can help minimize crying and promote sleep quality by creating a comfortable environment that mimics the closeness they feel in the womb. And lastly, the sleep position and environment. The safest position for an infant is to sleep in supine, which meaning on their back, to reduce the risk of sudden infant death syndrome. It is also recommended that while infants should sleep in the same room as their parents, they should have their own space, like a crib, to foster independence and safety.
All right, so as a quick discussion, OTs uses client-centered approach, which makes creating an environment for the home easier. We make it to resemble the NICU to kind of facilitate that comfortable environment for the child and the family. OTs can facilitate sensory integration, parent education, infant play, and sleep routine, and this creates a supportive environment for promoting development. And the preliminary guidelines offer suggestions in managing the daily care of infants, supporting their developmental needs, addressing the needs of the caregiver. So limitations we faced, there's not a whole lot of articles from OTs that describe their experience from NICU, and as many of us experience, IRB likes to take their time, and we did not get approval. So future direction for future groups, we would like for them to contact OTs in the NICU and just kind of enhance the guidelines with firsthand experience. In conclusion, so just to summarize it up, OTs within their scope of practice are able to address family concerns, facilitate therapeutic interventions, promote physical and emotional development, promote safe sleep, and modify the environment to promote a successful transition process. Research has demonstrated that education is essential to the caregivers, and parents really respond well to it. And most of parents really understand and appreciate proper education as they want to be part of this safe and effective transition from NICU to home. Educating the caregivers of the child can often be a difficult task for the healthcare workers when they don't have the proper documentation, hence this guidelines that we made. And our preliminary guidelines made the information clear and concise, and our goal is to have these guidelines available in any and all NICUs for use. Thank you. Any questions?
Who's the target audience for preliminary guidelines?
So our guidelines, we want them to be available in the NICU for healthcare workers to use to then educate and guide families with more clear information. Because like we were saying, the information on this was very hard to find. It was very unclear. I think, 59 articles we had out of 130. So it's less than half of the ones we even looked at. So the information's not clear, so we wanted to make sure that we had this information to give to the healthcare workers to then educate the families. And the families are more than free to take the guidelines themselves too. If they understand it, the OTs or NICU staff will educate them on how to use it. So it's really open for everybody.
So these guidelines are primarily for occupational therapists who want to be working in the NICU environment. It's a tool basically to help families transition smoothly to the home environment. Because we found that there's no guideline for occupational therapists, and we wanted to create a preliminary guideline for them in order for them to, I'm sorry, can you guys hear? I just basically in order for them to have enough information and then help create that smooth transition. Any more questions?
This group did an excellent job in reviewing the literature.
Thank you.
Compiling information to build these preliminary guidelines that help clinicians. And I understand perhaps you had limitations in the study when working to review clinicians. So understanding that, did you then go back to change your research question? Because it seems like research question focused on leadership of occupational therapists in the NICU and settings. So I'm curious, how was leadership defined?
Yeah, so the guidelines themselves weren't our initial project goal. It was to kind of develop like a survey to hand out to OTs in NICU to find out their role, find out where they feel they can improve, and then kind of advocate it from there. Because we didn't get IRB approval, we couldn't do that, and these guidelines to work on them, we didn't need approval. So we switched to this.
So we're using the guideline as a way for OTs to take leadership in this transition, basically.
I like the guidelines better, that's just me.
Okay, that makes sense. Thank you. Again, thank you for your thorough review of the literature to build these guidelines. And eventually, I would imagine the information would be sort of distilled in a way that can be applicable, usable to clinicians and even families of all literacy levels.
Yeah.
We would try to make it easy for parents to understand.
Okay.
Not like throw in, very like clinical terms. So.
Yeah, in like the description of all the interventions, we tried to keep it as straightforward in like layman terms as we could. There's our references.